This is an upper GI scope made by Karl Storz, which is used for examination of the upper GI tract, that is the esophagus, stomach, the duodenum, first and the second part. It can be used for diagnosis as well as therapeutic. Diagnosis in cases of lesions in the esophagus like cancer of the esophagus or stricture of the esophagus or any esophageal lesion. We can also examine the reflux if it is there, that is hiatus hernia we can diagnose. We can also use it for stomach examination to see if there is any growth in the stomach. Biopsies can also be taken, and this is also used for ruling out duodenal ulcers. This instrument can be also used for examination, diagnostic and also therapeutic. Therapeutic, as I told you, is for the taking biopsies. You can also deploy stents in inoperable cancer of the esophagus. This device does the whole procedure under a spray local anesthesia. Patient does not have to stay in the hospital, can go home within 1 hour of the procedure. The most important thing is this procedure is totally painless, and the procedure can be done on an OPD basis, and there is no admission required. And we get the diagnosis by looking in rather than guessing. This is a colonoscope from Karl Storz. We do this procedure on a daycare basis, since we have to give a short anesthesia called TIVA, that is total intravenous anesthesia for the procedure. Patient comes in the morning, we prepare the colon by giving medications to clear the gut. After the large intestine is clear, we look inside after a short anesthesia. This procedure is painless, and since there is anesthesia, there is no discomfort to the patient, and we get the diagnosis. We can also do a biopsy. In certain cases where we need to stent the large intestine because of growth constricting the large intestine, this can be used. It is also used for excising polyps in the large intestine and also used for biopsy. And you don't have to open up to see, you can just look through this. It also comes handy when you're doing an operative case and you have to see where exactly the lesion is, and the surgeon is unable to detect the early lesion. Then we put the scope during the surgery and delineate the area by illumination, and the surgeon uses to remove the malignant tissue. So this is a colonoscope. It is about 160 centimeters long, done on a daycare basis, painless, comfortable, and you get the diagnosis directly. You don't have to rely on images of a CT scan or a barium study. You can get your tissue diagnosis also by taking a biopsy. Thank you.